So in this video, I would like to explain about the Schick test. Schick test is developed in 1913. 1913 is a skin test. Skin test. So why we are calling it as a skin test, right? So this test is done in the two arm, right and left arm of the skin intradermally to determine whether or not a person is susceptible to diphtheria. So this Schick test is performed to detect whether the individual is immunized or not against the bacterial disease Corynebacterium diphtheria. Corynebacterium diphtheria. So Schick test. Schick is the scientist name. So this test was named after its inventor called Bela Schick. Bela Schick, he is an Hungarian-born American pediatrician. American pediatrician. So this test was created when immunizing agents were scarce and not very safe. Not very safe. So as newer and safer toxins became available, susceptibility tests were no longer required. So nowadays we are not performing this Schick test since the availability and it's very safe to administer. So we do not have any fear to administer this diphtheria toxide nowadays. So this test is no longer done in the clinics. So I said that it is an intradermal test. So in this Schick test, test sample and control sample is taken. Test sample and control sample is taken. In the test sample, there is only toxin, diphtheria toxin presented in the test sample. Then another sample is the control. In the control, the Schick toxin is inactivated by heat. Inactivated by heat. So this both sample test containing toxin and control containing inactivated toxin are injected through intradermally 0.2 ml of toxin as well as inactivated toxin of test and control are injected in left and right arm. For example, test can be injected in one arm, control can be injected in another arm. So this test will find the antitoxin or immune status and also the state of hypersensitivity to diphtheria toxin. So after injecting the toxin as well as control, there are some reactions. Either maybe negative reactions or positive reactions or pseudo-positive reactions and combined reactions may observed after injecting into the arms. First, we will have a look about the negative reactions. Once injected into the arms, the left and right arm, right? So no reaction. That is called as negative results. It means that the person is immune. If the negative reaction is observed, that means both the hand does not show any hypersensitivity reaction, right? Hypersensitivity reaction means it is a negative reaction. So that individual do not require any toxide to inject in order to increase the immune response against Corynebacterium diphtheria. So negative results indicate that the person is immune. There is another possibility of positive reactions. In this case, in the test arm, the test sample injected arm may have a circle of red swelling. Red swelling may observed around 10 to 50 millimeter. 10 to 50 millimeter diameter of circle may be observed in the test arm within 24 to 36 hours. Within 24 to 36 hours. Later on, it slowly fades into brown batch. Brown batch. That means positive reaction. Positive reaction. At the same time, the control arm shows no change. Control arm shows no change. That means the person is susceptible to diphtheria. Susceptible to diphtheria. That person need a diphtheria toxin. So the individual need diphtheria toxin injection. Diphtheria toxin injection since the person is susceptible to diphtheria. Susceptible to diphtheria. So once the individual got red color swelling in the test arm, right? We need a injection of toxoid, diphtheria toxoid, when it is positive reaction. There is another two kind of reaction. There is a pseudo positive reaction and combined reaction. Pseudo positive reaction means in the test arm, the swelling or the circle of hypersensitivity reaction less than that normal positive reaction, less than that true positive reactions. If the circle of swelling is less than 10 to 50 millimeter diameter, means that is the pseudo positive reaction. Pseudo positive reactions. Pseudo positive reactions if it's fats by fourth day. If it's fats by fourth day, then that allergic reactions found to be certain individuals. These kind of allergic reactions may be found in some individuals. That shows the Schick negative. Schick negative. So the pseudo positive reactions show the Schick negative. If the individual showing the pseudo positive reaction less than the true positive reaction, means that result is negative, that individual do not require toxoid vaccine, do not require toxoid vaccines, as that person is immune against Corynebacterium diphtheriae. Corynebacterium diphtheriae. Then another one result may be observed, that is a combined reaction. Combined reaction. In this case, control arm shows pseudo positive reaction, and test arm shows positive reactions. Test arm shows positive reactions. So this case combined means both control having less than the true positive reactions and test arm showing the positive reactions. That means control arm showing less than 10 to 50 millimeter diameter and test arm showing that exactly 10 to 50 millimeter diameter swelling in the hand shows that combined reaction. This person also susceptible to diphtheria. That means this person is not having immune power against diphtheria. So this person has to take diphtheria toxoid vaccine. Diphtheria toxoid vaccine. Thank you.